I'm about to share something that almost killed me at 73 years old, and it wasn't what you'd think. It wasn't a heart attack, cancer, or an accident. It was 5 critical blood pressure mistakes I made for over a decade that my cardiologist says nearly caused a massive stroke. I know what you're thinking. Blood pressure? Everyone talks about it. Doctors check it constantly. What mistakes could there be? That's exactly what I thought. But I'm Gerald Thompson. I'm 73 years old. I live in Miami Beach, Florida. And 8 months ago, I was rushed to Jackson Memorial Hospital with a hypertensive crisis. My blood pressure was 220/130. I had blinding headaches, chest pain, couldn't speak clearly, and the ER doctor told my wife I was minutes away from a catastrophic stroke that would have either killed me or left me permanently disabled. The terrifying part? I'd been taking blood pressure medication for 12 years. I thought I was doing everything right. Today I'm going to share the 5 critical mistakes my cardiologist identified that nearly cost me my life, why these mistakes are incredibly common, especially among men over 70, what the research says, and the changes I made that dropped my blood pressure from dangerously high to perfectly controlled. If you're over 60, on blood pressure medication, or have been told you have hypertension, you absolutely need to hear this. Let me tell you what happened. My name is Gerald Thompson. Most people call me Jerry. I'm 73 years old, and I live in Miami Beach, Florida, specifically in the South Beach neighborhood near Lincoln Road. I've lived here for 26 years. My wife Sandra and I moved from New Jersey when I retired from my 38-year career as a mechanical engineer. We fell in love with Miami Beach immediately. The beautiful Art Deco architecture along Ocean Drive, the gorgeous beaches right on the Atlantic Ocean, the vibrant Cuban culture in Little Havana, the Wynwood walls with incredible street art, the amazing restaurants along Collins Avenue, the year-round warm weather, perfect for outdoor living. We bought a 2-bedroom condo in a high-rise building with ocean views. Sandra and I had wonderful years here. Morning walks along the beach boardwalk, afternoons at the Bass Museum of Art or the Holocaust Memorial, dinners at Joe's Stone Crab or Versailles Restaurant in Little Havana, weekend trips to the Everglades or the Keys. Sandra is still healthy and active at 71, thank God. But I nearly left her a widow 8 months ago because of mistakes I didn't even know I was making. Let me give you context. I was diagnosed with high blood pressure, hypertension, in 2012 at age 61. My doctor at the time, Dr. Patricia Gomez at Mount Sinai Medical Center, put me on lisinopril 10 mg daily. My blood pressure at diagnosis was 156/96, not catastrophically high, but enough to require medication. Dr. Gomez explained hypertension increases risk of heart attack, stroke, kidney disease, and dementia. She said, "Jerry, take this medication daily, and you'll be fine." I did exactly that. For 12 years, I took lisinopril every morning without fail. I assumed that meant my blood pressure was controlled and I was protected. I was wrong, dangerously wrong. And I made 5 critical mistakes that nearly killed me. Mistake 1, taking my medication, but never checking my blood pressure at home. The first and biggest mistake was assuming that because I took my medication daily, my blood pressure was automatically controlled. I went to the doctor maybe twice a year for routine checkups. They'd check my blood pressure. It was usually around 135/85 or 140/888, and the doctor would say, "Looks good, keep taking your medication." I never questioned it. I never checked my blood pressure at home. I didn't own a blood pressure monitor. 8 months ago, I started experiencing symptoms I dismissed as stress or aging. Occasional headaches, slight dizziness when standing up, occasional blurred vision, feeling flushed and hot. I ignored them. Then one Saturday morning in April, I woke up with a blinding headache, the worst of my life. I felt pressure in my chest. When I tried to speak to Sandra, my words were slurred. She immediately called 911. The paramedics arrived within 8 minutes, checked my blood pressure, and I heard one say to the other, 220 over 130, hypertensive emergency. They rushed me to Jackson Memorial Hospital. In the ER, after stabilizing me with IV medications, Dr. Marcus Rodriguez, the attending cardiologist, sat down with Sandra and me. He said, "Mr. Thompson, you were minutes away from a major stroke. Your blood pressure was dangerously high, 220/130. At that level, blood vessels in your brain are at extreme risk of rupturing. You're incredibly lucky." I was shocked. I said, "But I take my blood pressure medication every day. How is this possible?" Dr. Rodriguez asked, "When was the last time you checked your blood pressure at home?" I admitted I'd never checked it at home, only at doctor visits twice a year. He shook his head. "That's mistake number one, and it's incredibly common. Blood pressure fluctuates constantly throughout the day. It's affected by stress, diet, activity, sleep, and dozens of other factors. Checking it twice a year at the doctor's office tells us almost nothing about what your blood pressure is doing the other 363 days. You could have normal readings at those visits and dangerously high readings the rest of the time. That's exactly what happened to you." He explained that home blood pressure monitoring is absolutely essential for anyone with hypertension. You need to check your blood pressure at least twice daily, morning and evening, and keep a log. That's the only way to know if your medication is actually working and if your blood pressure is truly controlled. Research overwhelmingly supports this. A 2017 study in JAMA found that patients who monitored blood pressure at home had significantly better blood pressure control and 30% lower cardiovascular event rates compared to patients who relied only on office measurements. Another study in hypertension found that home monitoring detected uncontrolled hypertension that office visits missed in over 40% of patients. Dr. Rodriguez prescribed me a blood pressure monitor. I bought an Omron Series 10 from Walgreens on Alton Road for $79. He taught me proper technique. Sit quietly for 5 minutes before measuring. Feet flat on floor, arms supported at heart level. Take 2 readings, 1 minute apart. Record both. I now check my blood pressure every morning at 7 a.m. and every evening at 7 p.m. without fail. I keep a detailed log in a notebook. This simple habit has been absolutely critical to getting my blood pressure under control. Mistake 2. Never questioning whether my medication dose was still appropriate. The second mistake was assuming the medication dose prescribed 12 years ago was still appropriate today. When I was diagnosed in 2012, Dr. Gomez prescribed lisinopril 10 mg daily. That dose worked initially. My blood pressure dropped to around 130/82. But over 12 years, I never questioned whether that dose was still adequate. I just kept taking the same 10 mg pill every morning, assuming it was still working. Dr. Rodriguez explained this was a critical error. "Jerry, as you age, blood pressure tends to increase. Blood vessels stiffen, kidneys become less efficient, weight changes, other health conditions develop. The medication dose that controlled your blood pressure at 61 may be completely inadequate at 73. Your blood pressure should have been reassessed regularly and your medication adjusted accordingly. The fact that you were still on the exact same dose 12 years later suggests your doctors weren't monitoring you closely enough." He was right. Looking back at my medical records, my blood pressure readings at doctor visits had been creeping upward over the years. From 130/82 in 2013 to 135.85 in 2016 to 140.88 in 2020. But because those numbers were technically not terrible, no one increased my medication. Meanwhile, at home, if I'd been checking, my blood pressure was likely much higher and climbing steadily. Dr. Rodriguez completely revamped my medication. He increased lisinopril from 10 mg to 20 mg, added amlodipine 5 mg, a calcium channel blocker, and added hydrochlorothiazide 12.5 isomers, a diuretic. This triple combination brought my blood pressure down dramatically. Within 2 weeks of the new regimen, my home readings averaged 122/76, perfectly controlled. Research confirms medication should be adjusted regularly. A 2019 study in Circulation found that patients whose blood pressure medications were regularly reviewed and adjusted had 25% better blood pressure control and significantly lower stroke risk compared to patients on static medication regimens. The lesson: never assume your blood pressure medication from years ago is still appropriate. Blood pressure should be reassessed at least every 3 to 6 months, and medication adjusted as needed based on home monitoring data. Mistake 3. Eating high-sodium foods daily without realizing it. The third mistake was my diet, specifically consuming massive amounts of sodium daily without any awareness. I thought I was eating relatively healthy. I didn't add salt to my food at the table. But Dr. Rodriguez asked detailed questions about my typical diet, and I described it honestly. Breakfast was usually a bagel with cream cheese from Einstein Bros on Alton Road, or occasionally Cuban bread with butter. Lunch was often a Cuban sandwich from a local cafe, or sometimes pizza from a place on Washington Avenue. Dinner was frequently eating out, Chinese food from a restaurant on Collins Avenue, or pasta from an Italian place, or sometimes steak from a steakhouse. Snacks were cheese and crackers, pretzels, or chips. Dr. Rodriguez stopped me. Jerry, every single thing you just described is loaded with sodium. That bagel with cream cheese, probably 600-800 mg of sodium. Cuban sandwich, easily 2,000 mg. Pizza slice, 700-900 mg. Chinese takeout, often 2,000-3,000 mg for one meal. Restaurant pasta, 1,500-2,000 mg. You're consuming 5,000 to 6,000 mg of sodium daily. The American Heart Association recommends no more than 1,500 mg daily for people with hypertension. You're consuming 4 times that amount. I was stunned. I had no idea. Dr. Rodriguez explained that processed foods, restaurant meals, bakery items, and prepared foods are absolutely loaded with hidden sodium. Even foods that don't taste salty, bread, cheese, sauces, deli meats, contain huge amounts of sodium. And sodium directly raises blood pressure by causing fluid retention and increasing blood volume. Research strongly supports low-sodium diets for hypertension. The DASH sodium trial found that reducing sodium intake to 1,500 milliliters daily lowered blood pressure by an average of 11.5 mmHg, equivalent to the effect of 1 blood pressure medication. Another study in BMJ found that reducing sodium by 1,000 mmHg daily decreased stroke risk by 18%. I completely overhauled my diet. I stopped eating out almost entirely. I cook at home now using fresh ingredients: chicken breast, fish, vegetables, brown rice, beans. I check nutrition labels obsessively and avoid anything with more than 200 mg sodium per serving. I use herbs and spices for flavor instead of salt. My sodium intake is now around 1,500 milliliters daily. This change alone dropped my blood pressure significantly. Mistake 4. Drinking alcohol regularly. In moderation. The fourth mistake was alcohol consumption. I'd been drinking alcohol regularly for decades, what I considered moderate drinking. Typically, I'd have 2 glasses of wine with dinner most nights, or sometimes 2 beers. On weekends, maybe 3 drinks. My doctors had always said moderate drinking was fine, even potentially healthy for the heart. But Dr. Rodriguez asked specifically about my alcohol intake. When I described my typical consumption, he shook his head. Jerry, 2 drinks daily is not moderate for someone with hypertension. It's too much. Alcohol raises blood pressure significantly, especially with regular consumption. For someone with your condition, the recommendation is no more than 1 drink per day maximum, and ideally less. He explained that alcohol raises blood pressure through multiple mechanisms. It increases cortisol and adrenaline, causes weight gain, interferes with blood pressure medications, disrupts sleep, which elevates blood pressure. Your nightly 2 glasses of wine are probably raising your blood pressure by 5-10 points. Combined with your other risk factors, that's extremely dangerous. Research confirms this. A 2019 meta-analysis in hypertension found that reducing alcohol from 2 drinks daily to 0 or 1 drink lowered blood pressure by 5.54 Mercury. Another study found that alcohol consumption above 1 drink daily significantly increased stroke risk in hypertensive patients. I cut my alcohol consumption dramatically. I now have maybe 1 glass of wine 2 or 3 times per week, not daily. Some weeks I don't drink at all. This change has been harder than the diet changes, socially and emotionally. But Dr. Rodriguez was clear. Your choice is between wine and your life. Choose wisely. I chose life. Mistake 5, not managing stress and sleep problems. The 5th mistake was ignoring chronic stress and poor sleep. For years, I'd had difficulty sleeping, trouble falling asleep, waking multiple times nightly, waking too early. I'd average 5-6 hours of fragmented sleep per night. I also had significant stress, financial worries about retirement savings, anxiety about health, frustration with aging, concern about Sandra's health. I never mentioned any of this to doctors because I didn't think it was relevant to blood pressure. Dr. Rodriguez asked about my sleep and stress levels. When I described them, he said, "This is your 5th major mistake. Poor sleep and chronic stress are absolutely critical factors in uncontrolled hypertension. Sleep deprivation and stress both elevate cortisol and adrenaline, which directly raise blood pressure. 6 hours of poor sleep can raise your blood pressure by 10 to 15 points. Chronic stress can raise it even more." He explained that addressing sleep and stress is just as important as medication. He referred me to a sleep specialist who diagnosed me with mild sleep apnea and prescribed a CPAP machine. He also referred me to a therapist for stress management. I was initially resistant. I didn't want to sleep with a machine on my face, and I didn't think therapy was necessary. But Dr. Rodriguez was insistent. Research strongly supports addressing sleep and stress. A 2020 study in hypertension found that treating sleep apnea reduced blood pressure by an average of 7.4 mmHg. Another study in JAMA found that stress reduction through meditation and cognitive behavioral therapy significantly lowered blood pressure in hypertensive patients. I've now been using a CPAP machine for 7 months. I sleep 7-8 hours nightly, wake feeling actually rested. I attend weekly therapy sessions where I've learned stress management techniques, deep breathing, progressive muscle relaxation, cognitive reframing. I practice these daily. Combined with better sleep, my stress levels have decreased dramatically, and my blood pressure has improved significantly. The results: 8 months later. 8 months after my hypertensive crisis, my transformation is dramatic and medically documented. My blood pressure is now consistently controlled, averaging 118/72 on home monitoring which is absolutely perfect. Dr. Rodriguez calls it textbook normal. I check it twice daily and keep detailed logs. I haven't had a single hypertensive episode since April. My medication regimen is stable and effective. Lisinopril 20 mg, amlodipine 5 mg, hydrochlorothiazide 12.5 mg daily. I take them every morning at 7 a.m. without fail. My diet is completely transformed. Sodium intake under 1,500 milliliters daily. Home-cooked whole foods. Minimal processed foods. Alcohol consumption is minimal. Maybe one drink 2 to 3 times weekly. I sleep 7-8 hours nightly with my CPAP machine. I practice daily stress management. Dr. Rodriguez told me at my last appointment, "Jerry, you've done everything right since April. Your blood pressure is perfectly controlled now. You've likely added 10-15 years to your life by making these changes. More importantly, you've dramatically reduced your stroke risk from extremely high to normal range. Keep doing exactly what you're doing." My message to you, if you're over 60 and have high blood pressure, please don't make the mistakes I made. Don't assume your medication is working just because you take it. Buy a home blood pressure monitor and check your blood pressure twice daily, every single day. Keep a log. Share it with your doctor. If your readings are consistently above 130/80, your medication needs adjustment. Don't assume the medication dose from years ago is still appropriate. Blood pressure should be reassessed every 3 to 6 months and medication adjusted based on home readings. Don't eat high-sodium foods without awareness. Read every label, cook at home, avoid restaurants. Don't drink alcohol daily thinking it's moderate. For hypertensive patients, 1 drink maximum is the limit, and less is better. Don't ignore sleep problems and stress. They're not separate from blood pressure. They directly cause it. I'm 73 years old. 8 months ago, I nearly died from a stroke I didn't see coming. Today, my blood pressure is perfectly controlled, and I'm healthier than I've been in 20 years. These 5 changes saved my life. If this story resonates with you, please leave a comment below. Do you have high blood pressure? Are you making any of these mistakes? What questions do you have? Let's start a conversation. Hit that subscribe button for more honest conversations about men's health, cardiovascular wellness, blood pressure management, and life-saving information that doctors often don't explain clearly. Drop a like if this was valuable. It helps others find this content. Share this with anyone you know who has high blood pressure. Remember, blood pressure is called the silent killer because you feel fine until you suddenly don't. At 73, I learned that lesson almost fatally. Don't wait for a crisis. Check your blood pressure today. Make the changes now. Your life depends on it.